With anything in life, there is always the potential for some negative effects, and there can even be too much of a good thing. Obviously, taking any kind of medication is no exception. And today, this is going to be part one of a multi part series where I tell you how to mitigate and manage the main common side effects that I often see with the GLP-1 receptor agonists, such as Saxenda, Ozempic, Wegovy, and that sort of thing. But before we jump into that, welcome back to the program, you beautiful people. My name is Dr. Dan. I'm a pharmacist turned obesity expert. And hey, I need you to turn on the subscribe button down below so that you don't miss another episode. As well, I need you to check me out on my other channels. I'm on the gram, the talk, the tick, the tweet, the book, you name it. I am out there. At the official Dr. Dan is the handle as well. Check out my website, healthcareevolve.ca. We're going to have some really cool updates coming up here in the near future. But hey, while you're on my website, if you need some additional support in your weight management journey, you can book a free consult with myself there to see if you would be a good fit for myself and our team and what we can do to help you. So, today we are covering heartburn, or sometimes referred to as gastroesophageal reflux disease, or GERD for short. Now, heartburn is definitely one of, if not the most common side effect that my patients will report to me, and the literature tends to agree with me. There's a few other GI side effects that are all kind of competing for the top spot, but I really find heartburn is maybe the most reported or probably the most bothersome one, if you will. Now, just as a really quick point here, because I would love to continue not getting sued, that would be fantastic. All of the information that I'm going to be presenting in this video and the subsequent videos afterwards is for informational purposes only. Of course, if you have your own individual situation that you're dealing with, you need to follow up with your personal care providers to get the appropriate care and get things looked after in the best way possible for your individual situation. Please don't just blindly follow the advice of a random, albeit knowledgeable, and some might even say handsome fella off the internet. All right? Now, to start, heartburn or GERD is essentially this process where acid from our stomach flows back up into the pipe, the esophagus, we call it, the pipe that connects our stomach to our mouth. And when this occurs, essentially that acid is coming up and causing irritation in that tube between our stomach and our mouth and can cause a burning sensation in the middle of your chest there where the tube is going down, hence heartburn. Now, heartburn tends to be worse immediately after a meal because, well, your stomach is full, so there's a better chance that acid can get up into the tube there. As well, when you lay down at night, that whole pesky gravity thing is suddenly gone, and that acid can more easily travel up into that food pipe. Now, not everybody who experiences heartburn is going to report this burning sensation in their chest. Some people do report just a generalized chest pain or this feeling like there's a lump or they need to swallow something in their throat. And depending on the level of irritation and how long it's been going on for, some people might even report difficulty swallowing or even having pain swallowing. So when they swallow the food travels down, and there could actually be literal pain as it travels down and into the irritated parts of your esophagus. Furthermore, some people will report these sulfur burps, and it's kind of like this acidic, sour tasting grossness that sometimes has food with it in the back of your throat, and it can be obviously very, very unpleasant. But certainly, this can be just the only side effect that some people might report. If you remember back to your good old college days where you maybe had one too many wobbly pops and suddenly you're asking your best bud to hold your hair back while you purge that Big Mac from dinner, yeah, you know that taste, that flavor that you got at that point, that's what we're talking about. Now, some of the more low key symptoms, if you will, that people might experience could be things like a chronic cough or worsening of their asthma symptoms, depending on how severe the reflux is that they're experiencing. And really, the worst case scenario out of all of this is that these symptoms are actually waking you up in the middle of the night and causing you to have a mouthful of acid that even toothpaste cannot remove for you. Now, the reason why the GLP-1 receptor agonists cause heartburn is because GLP-1 is a hormone that's naturally produced by our body, and one of the main things that it does is it slows down gastric emptying, or how quickly food moves from your stomach to your small intestine. So, if things are moving more slowly and say you overeat, or even if you don't in some respects of things and you just eat a meal, if that food is not moving down very quickly and it's not going down into that small intestine, well, the only place it sometimes is going to have to go is back up. Now, for most individuals, these symptoms are going to be mild and they're only going to last for a very brief time while your body is getting used to the medication and that process of how quickly food's moving from your stomach to your small intestine starts to speed up again. For a very small percentage of people, it could be worse though, where it might feel like you're turning into a fire breathing dragon or potentially having an exorcism. So, there is definitely the two spectrums. The latter, obviously, is much, much more rare in the sense that that is occurring. Now, as another brief aside with that whole not getting sued aspect of things, if you're not sure what you're experiencing is heartburn or not, go to the ER, go to your doctor. It's better to be safe than sorry because if we look at this whole chest region here, there's a pretty important organ that's going on there. And if something's going wrong with it, we need to get it looked at. And just in case you weren't picking up what I was laying down there, if you think you're having a heart attack, you need to go see a doctor like immediately. A lot of the signs and symptoms of heartburn can be overlapped with things like a heart attack. So making sure that it's clear in that regard of things, and it's always better to be safe than sorry. But if we have now established that what you are indeed experiencing is heartburn due to a GLP-1 receptor agonist or just heartburn in general, the management of it is pretty straightforward. And it's so much so that I'm just going to provide you a numbered list of things that you can ultimately do to not necessarily get rid of it altogether, but certainly can help you to manage it and dampen those symptoms down a little bit. So, number one, eating smaller and more frequent meals throughout the day. The purpose here is to have less volume in our stomach, less chance of acid coming up into our esophagus. The next thing I want you to think about here is think boring foods. We're not talking about spicy Taco Tuesday or hot wing Wednesday. I want you to think bland, boring, not overly spiced foods. Keep it nice and simple and things that are not going to ultimately aggravate that acid and cause that reflux to occur. In particular, and as I already mentioned, avoid the spicy foods if you can, reduce your chocolate consumption. Try to avoid the high fat, highly processed foods such as chips, fries, that sort of thing, and try to limit your dairy intake. We know that those can be more triggering overall in terms of reflux symptoms. I know they're the most delicious of all the things and stuff like that, but trying to limit and reduce the amounts of that food will ultimately help with those heartburn symptoms. Number three, alcohol and carbonated beverage intake. We're not here to relive college by any means. I know a number of people in my life that would be quite disappointed if I required their assistance to hold back what little hair I do have left at this point in my life. So try to reduce your consumption of those two items. They cause a lot of reflux and can definitely lead to some problems. Number four, take your time, smell the roses, or in this case, smell your food, enjoy it, savor it. Be mindful in how you're eating because really it can be a 0 to 100 very quickly with one tiny little bite where all of a sudden you're overeating and you're getting all of these heartburn symptoms. So take your time when you're eating, eat more slowly, and enjoy the process of the food that you are consuming. And for number five, do not, and I repeat, do not go and lay down on the couch, in bed, what have you, immediately after eating. Give your body some time to process that food, to get that digestive process going, to move that food down through into your small intestine. Because again, if you lay flat, all of a sudden that whole thing of gravity is going to allow that acid to come up nice and easily up into the esophagus, cause all kinds of problems and irritations there, and it's going to likely wake you up with that mouth full of acid. And furthermore, if you are experiencing heartburn symptoms, I recommend you try propping yourself up with a pillow or two, or maybe even three, to help gravity do its work to keep that acid in your stomach and out of your throat. Now, as a final note here, and this is really one of my least favorite practices, is using a drug in order to treat the side effects of another drug. Now, obviously, this is never ideal and obviously has its own risks that can come with it in more side effects from another drug. However, an argument certainly could be made in the short term of using drugs in order to manage the side effects from a GLP-1 receptor agonist, in particular, if you're getting a lot of benefit from that medication or it's something that is legitimately going to help you in the long term, and we just need to get you through this titration period while your body gets used to the drug. So for managing heartburn, one of my favorite go-tos is Gaviscon. My patients get a lot of benefit from it, and kind of like the TV commercial, It does kind of sort of create that raft type thing at the top of your stomach to prevent that acid from going back up into your esophagus. As well, it helps to neutralize the acid a little bit so it can dampen down some of those immediate symptoms you might be experiencing. But again, whatever works for you, whatever's been your tried and true method up to this point in time for managing heartburn can certainly work as well. And in a recent article by Wharton and Friends, they did actually recommend using the bigger guns such as Pantaloc, Dexilent, Lansoprazole, that sort of thing. So those are the bigger PPIs, we call them, or proton pump inhibitors. They are very effective at overall dampening down that acid production. So those would be something that you'd need to talk to your family physician about or whoever your personal care clinician is in order to get the proper management in that regard. So definitely some options and some things to keep in mind. Obviously, again, check with your primary care team as to what would be the best medication for your given personal situation. Now, there are some other strategies that we can look at in terms of the dosing of the GLP-1 RAs and using them in that regard of things, but I'm going to save that for a later blog because it's more applicable to other symptoms as well. So there you have it, you beautiful people. That is a breakdown of how we manage heartburn due to the GLP-1 receptor agonists such as Ozempic, Wegovy, Trulicity, and that sort of thing. And well, managing heartburn in general, that those strategies and things would be exactly the same things that we would use for just general heartburn as a whole. And in the next video, we're going to go over the side effect of nausea and vomiting because the two are often very related and kind of come hand in hand depending on the situation. But in the meantime, don't forget to hit the subscribe button down below so you don't miss that episode as well. Check me out on my other channels at the official Dr. Dan. I'm on the TikTok, the Facebook, the Gram. I am out there and I am posting daily in those regards so that you can get the most up to date information around everything that I'm doing and all of the evidence based medicine that I am putting out there for you. And until next time, you beautiful people, always remember small tweaks lead to massive peaks.